Let's talk about quarantine rules. Sorry, so moving on. Lifted for those that are fully vaccinated coming in from Europe and the US. Why the change of heart?
Well, it had been the case already in this country. British people coming back into the UK who are double jabbed won't have had to go on through quite the same level of quarantine there before. And I have to say, no decision has been made. Ministers will be meeting to discuss, go through the data. But this was discussed between the President of the United States and the Prime Minister during the G7. So it should be no surprise if we are looking at ways at how we can facilitate travel. But candidly, the most important thing is to make sure our borders are safe, that the public in the UK is safe, and that we don't waste the sacrifice the British public have made. And that's why we want to make sure we keep having the focus on people here being vaccinated, but also considering opportunities of how we reopen the economy, both domestically, but also potentially for people coming from abroad.
But we get the US thing, and obviously it's not reciprocated the other way at this stage, but Europeans will be able to come in if they're double jabbed, and Brits who've gone on holiday, if they're on the Amber Plus list, they won't have to quarantine when they come back.
OK, all those decisions are being considered by ministers. The Transport Secretary will be the person who, having had the discussion with the scientists, the medics, and considered that, will announce if there are going to be any changes.
When are they going to tell us? When are you going to tell us?
I don't know the answer to that. I think they may be meeting today, but like a lot of things, we do these reviews regularly as parts of government on the travel list that you'll be aware of. But it's about making progress, seeing how the vaccines have been really effective. And that's why domestically we still want more and more people to make sure they get the vaccine.
OK, let's assume that Europeans and Americans can come in to the country if they've been double vaccinated without having to self-isolate. And yet they won't be able to eat in a restaurant, say, that has been closed because the staff have been pinged and there's not enough of them there and they're having to self-isolate.
Well, people know that the app that's there, or indeed the phone calls by Test and Trace, are there for a reason. It's to let people know Test and Trace is specifically where they've been identified as people who've been in close contact with somebody who has coronavirus. And one of the defences we have against transmission, the best is that self-isolation element. Now, our vaccines will help towards reducing transmission, so that's still the case. But in terms of things like the app, this is really informing people. You may well be carrying the coronavirus and you don't know anything about it. So that's why we still want to continue to try and use self-isolation as an appropriate way to try and restrict the transmission of this awful virus.
But you can accept that that's a mixed message, potentially. People can come in who are double jabbed and don't have to self-isolate, but people who are already in the country, if they've been in close proximity with somebody who has COVID, then they have to self-isolate.
OK, I think
that's a bit confusing.
I think you and the public know that from the 16th of August, we anticipate that people in this country who've been double jabbed and had 14 days since their second jab will move into a different phase of being able to continue everyday life. The reason for going that bit longer, the further 4 weeks after the 19th of July, when we entered successfully into step 4 of the roadmap, again, is to give some more time to allow the effects of the vaccine to be fully made available. And that's why we will continue to try and have this approach that's sensible, allows people to go about their lives, but we're still encouraging people to get the vaccine.
The reason I ask you that is because the NHS, the Department of Health's advice says that daily testing is as effective as quarantining if you've been pinged. Why not adopt your own advice?
Well, what we've done is open up, I think, about 2,000 sites around the country, or we will be. I know that the NHS is doing specific testing on the effectiveness of home testing. So a lot of the work that's been done has been effectively under authorised or observed testing that people have done. I know that we as a government are trying to carefully go along this roadmap to recovery. I think we've done a heck of a job to get us to the 19th of July, really helped by the vaccines. But again, we still must be cautious because, as you know, although infections we can see are positively coming down, which is good news, they're still high. And we want to try and reduce that risk. But as we keep going along, I'm keen that we get more and more people vaccinated so genuinely we see the pressure on the NHS no longer be the problem.
Vaccination is a separate topic to what we're talking about just at the moment, if I may. Are you saying that there isn't enough capacity in the system to daily test people at the moment, which is why we have to wait until the 16th of August?
Well, the Department of Health, in partnership with the NHS, Public Health England, I should say, sorry, have set out a plan on how we can go for critical elements of critical sectors and also companies within that, without which many supply chains would just perhaps fall over. So that's why we've taken that approach so far. It's a measured, considered way of going through it. But again, I'm looking forward to the 16th of August when people will be able to, who've had the double vaccine, be able to have more freedoms.
But some sectors of the hospitality industry might not be able to last that long. They're on their knees.
I'm conscious of that. I represent a coastal constituency. I was out this weekend myself. I know that people are being careful in terms of working with their employees about aspects of social distancing, but we are making progress, and I'm conscious the hospitality sector would like us to act even further. But the very strong medical advice from the medical officers and the chief scientist is that we should keep to that 16th of August.
So there's no chance of that date coming forward?
Well, that's the very strong medical advice. Of course, as ever, all policies are kept under consideration, but that's the very strong advice.
OK, but it could come further forward.
I'm not going to speculate. I'm just flagging that at the moment, no advice has changed from our medical officers.
You talked about vaccinations. Michael Gove said yesterday that people who refuse the vaccine are selfish. Are they selfish?
Well, I think there are some people who are still scared of taking on a vaccine, but there's also seems to be a group of people who don't see why they need to have it because it protects more people than they consider it might protect themselves. I just think it's what's the reason not to have a vaccine, and I think it's something that we're all used to having vaccines for a variety of things. And we are going to continue to live with COVID. It's just going to be, I think, a new norm for us, that the annual booster, all other things like that. So I really do want to encourage people to not be scared or not consider that other people have done it so they don't have to bother. We all have a part to play.
And in answer to my question?
What was that? The
question is whether people are selfish if they don't have the vaccine.
Well, I wouldn't. I would say that I think a lot of people are scared. That's who I've come across. I'd just
so
point out there.
To say they're selfish. That's not the way to.
I'm not going to comment on other things that I've only read about myself in the paper this morning. But I think it's a case of what's the reason not to have a vaccine. There are some people who clinically been advised not to. There are other people who are just scared of it, and we need to help them overcome, I think, that fear.
And the third group who just don't want to have it, how would you describe them?
Well, I would encourage them to say, what is the point of not having the vaccine? You leave the responsibility to others. And just as other people, at the moment, we still have aspects of restrictions on our life, not necessarily imposed by government, far from it, but indeed just about how we're going around our everyday life. So whether it's about still passing on the vaccine, we know that can make still people, knowing the vaccines are not 100% effective with everybody, that they can still then become ill. So it's about a social responsibility, and I really hope people take up the opportunity.
But it's better to use a carrot than a stick to get people to have the vaccine.
Well, I want to encourage people to just go and do the right thing, in my view. And as I say, some people are still scared, and we need to help them understand what it is that
you've been double jabbed.
I have been, yeah.
Yeah, me too. Talk to me about the disability strategy. That's why you're here this morning. You want to talk about it in more detail. How will the disabled actually benefit?
Well, what we did is a big listening exercise, an online survey. We've had a number of workshops, roundtables around the country. And we wanted to understand from people with disability, how can we make your life easier every day? How can we help unleash your potential? And there were a number of things that came back, simple things that may seem quite trivial, but that perhaps I would take for granted, just how difficult it is to make sure that you can get transport. So we're doing more what we can do to help with accessibility to trains, things on buses, where we are putting up the audio-visual announcements on every single bus, or indeed the Department for Transport is now going to work on an app where people can contact the Guard at any time. Other things like making it easier for people to get into work. We estimate about 300,000 people fall out of work through being disabled or having health conditions, and we want people to be able to stay in work and progress in work. So there's aspects like that, as well as access to better housing, which is just easier for people's everyday lives. So there's a whole series of commitments, about over 100, and we've been informed by the strategy, by the people we want to try and help. And I'm excited about it. We're going to do an annual report. There's a chance to refresh it. We will keep working at it.
Do you think we should bring back chain gangs?
I think you're referring to comments made by the Prime Minister yesterday, where he was looking at community service. And I'm very conscious. We have a comprehensive scheme about people who've been in prison, how we help them get back into work. I think the Prime Minister was referring to community service and having a visible sense of justice for the victims of justice who see that people are actually doing community sentencing. And that's why I think that sort of approach, we do always have to remember the victim, but we always want to help the person who's committed the crime so they don't commit crime again.
He said chain gangs, though, didn't he?
Again, I've read it in the paper this morning.
Another one of your team using a bad choice of words.
Well, I think it's a very visual element of that, but it was about the fluorescent jackets, which are used in some parts of the country.
Chain gangs,
and he
Ms.
wants
Coffey.
to.
I mean,
he wants to make sure that that visible element is there. I think people associate that sort of high-vis jacket with something they may see on American films, but that's something where, as I say, it's a visible sense of justice that is being done in community centres.
Would you support the terminology?
I think that...
Yet again, one of your colleagues using the wrong phrase. Come on.
Well, what I will say, Kay, is that the intention is right, that we have a visible sense of justice being undertaken and the sentencing being undertaken.
OK.
At the same time, we want to help people who've left prison get back into proper work.
Just before I let you go, let me play you this clip. It is from a member of the opposition yesterday talking about your leader. Here we go.
He's a liar. I think he is a liar. I think he's... I mean, we've all seen Peter Stefanović's Twitter. I think it's now about 29 million views, setting out very clearly where he has lied over the things that he says in the dispatch box. Difficult to defend him?
Not at all, and I'm quite saddened by what's happened. A lot of this is done to drive small clips on social media. You know, I work in the House of Commons. The Chamber is a place where often we come together mainly about issues on which we disagree, discussing legislation and similar. You know, I know the Prime Minister has led from the front in tackling COVID. He's been leading from the front on the disability strategy. And I have every confidence in him. And frankly, so do the British people. They showed that when they got the election result in 2019. I'm afraid the opposition, Labour, cannot get over it.
Can you not accept that he does tell lies?
Look,
he may well be popular. I'm not disagreeing with you that. You did win the election, but he has been sacked twice for lying.
Kay, all I will say is the British people backed Boris to be Prime Minister. He's doing a great job. And frankly,
so it doesn't matter if he lies.
All this trivia that's generated by people just trying to get media clips, I'm afraid, doesn't work. We're in a grown-up situation. He's leading the country, and I'm very proud he's my Prime Minister.
And it doesn't matter if he lies?
I'm very proud he's my Prime Minister.
Thank you for joining us. I very much appreciate it. Thank you.